It's been another hit for Obamacare. Health insurer Aetna announced it will be pulling out of 11 of the 15 states where it has been participating in the Affordable Care Act. This follows other major insurers such as UnitedHealth and Humana, who also exited the exchanges. Here with more is Bloomberg News healthcare reporter Zach Tracer. And Zach, I really have two questions. One is, how can it be that Aetna is losing so much money on this? And number two, what does this do to Obamacare? So the first one first. When we first had Obamacare, it was thought this would be a boon potentially for health insurers because millions of people had to have health insurance. How can they be losing hundreds of millions of dollars?
You know, insurers have pointed to a few problems with Obamacare. One issue has just been a lot more sick people signing up, a lot fewer young, healthy people signing up than anybody expected. There's also questions about, did they charge too little? We've seen insurers for next year raising premiums, something like 23, 24%, the ones that are sticking around. So, there's a few different ways that they may have really gotten this market wrong, and now they're paying the price.
But originally, with the Affordable Care Act, it was thought that we're going to have mandatory participation to avoid the problem of the cherry picking, with the sick people getting insurance and the well people not. What happened to that?
That's right. You are required by law to have health insurance in this country, and you pay a penalty if you don't. But it's turned out to just be such an expensive product that people aren't willing to buy it. People that don't have a lot of health problems, they'd rather pay the fine than pay, what might be several $1,000s a year for health insurance.
So all those well people are basically paying the fine, getting out of it, and it's leaving the health insurers with the sick people.
That's right. That appears to be at least one of the things that's happening here.
What does this mean as a practical matter if you right now participate in an Aetna plan? It's 11 out of 15 states, and I see in some of those states there will only be one health insurer left. What does it mean if I'm buying my health insurance from Aetna?
That's right. So if you're buying health insurance from Aetna as an individual on an ACA exchange, you're going to have to go shopping in November. You're going to have to go and basically get health insurance from a new provider. It could be higher costs. It means you may not have the doctors that you want in your network.
Okay, in a word, how bad is it for Obamacare?
This could be a real challenge, real problem.